Hi guys, today we have a case of less sciatica pain and we're gonna try to solve it. The first things I'm doing is to try to correct the nutation of the sacrum. I'm gonna manipulate the sacrum in contour nutation. This is it's really helpful with people with hyperlordosis, like the case of Morgan, my model of the day. And then I'm gonna attack right away the piriform muscle that is the cause of the sciatica pain. Probably causated, the real root is a slipped disc in the hyperlordotic position of Morgan. So I press on the piriform muscle, not too much, because it's important not to smash the sciatic nerve. Right now I'm trying to work with active release technique, asking the client to press in against my hand, and then I try to relax the part that is really tight. Compared to the right side, the left side is pretty tight. I just asked her if it was painful, and she said that everything hurts. So I try to move around the deep six rotator muscle of the hips, and working on the attachment of the bicep femoris. After a strong work on muscle, I always want to give the client a sense where he can just relax, and you can't just give pain all the time, and pain has to be really measured. Right now I'm trying to release the bicep femoris with this technique that is pretty obvious what I'm doing. A way to create more relaxation is make the client work with you. So working in eccentric, so when the muscle is standing, you press on the muscle. Same way you can see going up along the bicep femoris. So I'm doing the same thing, like to work in that point. That point is where the muscle, the semitendinoso, semimembranoso, and the bicep femoral kind of meet. That point need a lot of work. And after the tension, you have like 10-15 seconds where it can work easily and go deeper without pressing too much. It's not a matter of pressing. It's a matter of like really try to make the patient relax while you're working deep. TFL always tight. As you say, hurting, and the glute medius tight all the time, especially when you have an hyperlordotic position. You can see the work I'm doing on the glute medius all the way down. The muscle needs some time to relax. It's not going to relax right away. Now working on the 4 position. I really love this position because it allows you to really touch the piriform muscle and all the muscle around the femur and go really deep. Breathing, the client should breathe and allow with awareness to relax the muscle that you're working on. Again, some more work on the bicep femoris, different position. It's important to work on different position to allow the client to understand what position in his body or in her body it's painful and what position is comfortable. Maybe the same work on the leg doesn't hurt in one position, but it's really painful in another. Then I work on some distraction of the hips, of the femur, into the acetabulum. Try to distract the muscle and the bone. And again, working on IT band, but it doesn't really need a lot of work. It's not a muscle, but clients for some reason like when you work the IT band. And some stretching of the hips, stretching of the quad, and stretching on the piriform and the 6 deep rotator, external rotator. Again, I'm working on the calf and the feet that need some opening. Sometimes problem especially on the sternal part of the leg is caused by supination of the feet. So it's good, especially if you train to work the mobility of the joint, especially the one in the ankle. Opening again. Okay guys, if you like this video, subscribe and see you soon.